What role do cytokines play in CFS immune dysfunction? Imagine your immune system as a busy communication network, with cytokines acting like messengers that tell immune cells how to respond. In people with myalgic encephalomyelitis or chronic fatigue syndrome, this messaging system often becomes imbalanced. Research shows that cytokine levels are altered in ways that can contribute to the ongoing symptoms of the illness. Cytokines are proteins that help regulate immune responses and inflammation. In CFS, many studies find increased levels of certain cytokines called pro-inflammatory cytokines. These include transforming growth factor beta, tumor necrosis factor alpha, and various interleukins. Elevated transforming growth factor beta, for example, is linked to immune suppression and persistent inflammation. This chronic inflammation can lead to symptoms like fatigue, muscle pain, and brain fog. Scientists have also observed a shift in immune response patterns. Instead of a balanced immune system, there is often a dominance of T helper to cytokines, which can impair the body's ability to fight viruses and regulate immune activity effectively. This skewed response might make it harder for the body to clear infections or control abnormal cells, possibly contributing to ongoing illness. Further research shows that cytokine profiles in CFS are complex and sometimes inconsistent. Some cytokines, such as interleukin-4, interleukin-5, and interferon gamma, are linked to disease severity and symptom duration. This suggests that cytokine levels could reflect how active or advanced the disease is, although they are not yet reliable diagnostic markers. The immune dysfunction in CFS also involves impaired natural killer cell activity and T-cell exhaustion. When cytokines like interferon gamma are decreased, immune cells become less effective at fighting infections. This exhaustion can cause the immune system to become less responsive over time, which may explain why symptoms tend to persist or fluctuate. It's important to understand that cytokine changes are not the same for everyone. Some studies report episodic fluctuations, possibly influenced by viral reactivations or stress. This variability highlights how complex and individual the immune response in CFS really is. Overall, the picture suggests a state of chronic immune activation combined with immune suppression and dysregulation. In summary, cytokines are central players in the immune dysfunction scene in CFS. They promote ongoing inflammation, skew immune responses away from effective antiviral defense, and contribute to immune cell exhaustion. These changes are linked to symptom severity and disease progression, though the exact patterns can vary widely. Understanding these immune signals helps researchers piece together the complex puzzle of CFS and may eventually lead to better biomarkers and treatments. However, since cytokine profiles can differ from person to person, they are just one part of a larger picture. Anyone experiencing symptoms should consult healthcare professionals for personalized care, as immune dysfunction is only one aspect of this multifaceted illness.